I now request Dr. Mangai Karasi ma'am, retired HOD, Transfusion Medicine, Coimbatore Medical College Hospital. She also was a state nodal officer for the plasma exchange program. Thank you, ma'am.
Good morning, all. First, I thank you, the NHM and TNHSP, for giving me this opportunity to talk about this topic in front of this August gathering. Firstly, yes, I am Dr. Mangai Karasi. I am nodal officer for PLEX and I am a retired professor of Blood Bank, Coimbatore Medical College. Today, I want to discuss about the hub and spoke model of the treatment we have delivered across Tamil Nadu in treating rodenticide poisoning. Next slide. Before going into hub and spoke model, just a small intro. All of you know that the main content of the rodenticide poisoning is yellow phosphorus. But the patient always mix this with alcohol, and sometimes they mix this with the anticoagulant. So it is our responsibility, who is in the tie, to inquire about whether they have taken the tube itself or along with the anticoagulant, or you have to see the tube, what's the main content, and whether they have mixed with alcohol. And we have received a case who have mixed both rodenticide poisoning and cow dung poisoning, sani powder also. So this is our duty to inquire. And everyone know it's a multi-system poison that affects liver, renal, cardiac and pancreas. Next slide. Next slide. Yes, the challenges we face and why we have imported this hub and spoke model is the estimation of the phosphorus in the blood is very difficult and there is no proper antidote, and as Sir has said, only limited access to the liver transplant, and the cost is very high and the failure rate also high. And the very, very important thing in government setup is the late referral and lack of first aid. The next slide. So before going into that, the case burden of Tamil Nadu, the total cases, this is the available data now, the total cases is 650 to 750 cases per year, and the main chunk is from Viluppuram and Kadalur. And again, the challenge is late referral, lack of first aid, and the toxin is by the time absorbed. Next slide. Next slide. As this is the study from Jan to June 2019 by Tamil Nadu chapter of gastroenterologists. It is conducted over 6 districts among 450 patients. And to our dismay, the age group is 15 to 34 years. That is very important working age group for the poor people in Tamil Nadu. They are 15 to 34 years is very, very important. That is the working manpower in any low income group. The finding is 35% died or they were discharged in moribund state. But 99% could not access the urgent liver transplant. Urgent liver transplant means within 2 days they have to undergo liver transplant. So they couldn't access to liver transplant. So the South Indian gastroenterologists, they have given us the novel treatment, that is plasma exchange, to treat the liver failure so that there is no need to go for liver transplant. So the people in Mumbai, there is no need to go to aeroplane, just we can treat the liver failure in our government hospital in the tertiary care itself. That is the plasma exchange, and how to deliver this plasma exchange across Tamil Nadu. That model is the hub and spoke model that is delivered across the Tamil Nadu state. Next. So what's a hub and spoke model? It is very simple. It is nothing but, it is like wheel arrangement. The hub is in the center. That is our tertiary care hospital. That is our medical college hospital. And there are multiple spokes. Like a wheel arrangement, there are multiple spokes. And the spokes are multiple levels. The primary health centers are the first level of the spoke. And the headquarters hospital and taluk hospitals are the second level of the spoke. And hub is our medical college hospital. In the primary health center, their role is only to give first aid. In the secondary level hospital, in Taluk and headquarter hospital, they can treat the cases without organ damage. Once the organ damage has developed, they have to refer the case to Medical College Hospital, that is the hub, where the plasma exchange will be done. Next. So, in primary health center, that is the spoke, the treatment, but this is the first aid, whether the case is admitted in primary health center or directly in the secondary level spoke or directly to the tertiary level care. So, all the HOD of medicine, they knew, there is no need for me to explain this. So, the first aid should be given in the primary health center, or the assessing of the ABC and the gastric lavage and the oral activated charcoal, all these things, it should be given as a first aid in the primary health center. And also, if the case is directly admitted in the secondary level hospital or tertiary level hospital, this is the first aid. Strictly no sedatives. Next. And few lab investigation can be done in the primary health center. We can do the complete blood count, blood sugar, LFT, RFT, electrolyte, and if possible ECG. And when to refer to secondary level hospital? We can refer the patient, the patient who has landed up in the primary health center will be referred to the secondary level hospital if there is altered blood parameters, and if there is altered LFT, RFT, anything, any altered parameter, or leukopenia, any altered parameter, they should be referred to secondary level hospital. And if they want to send the patient for monitoring the complication. Then next slide. Then coming to secondary level hospital, that is spoke, again it's a spoke. The same, all the, if directly comes to the secondary level hospital, you have to give the first aid, everything, no sedatives, everything. And you have to daily clinically monitor, and you have to monitor the sensory level of the patient. Then you have to do the serum calcium, and you have to do lab parameter, particularly INR, prothrombin, and you have to see if there is any increase in the liver enzymes. And all the medical managements, as Sir has mentioned, like NAC and other proton pump inhibitors, everything, it should be given in the secondary level hospital, in the Taluk or headquarter hospital. And when to refer to tertiary level hospital? We have to refer the case from secondary level hospital to tertiary care center when the patient has signs and symptoms and laboratory evidence of organ damage and persisting symptoms even after 7 days. We have to refer the case to tertiary care hospital. So, next slide. So, in the tertiary care hospital also, if the patient directly comes to the tertiary care hospital, you have to give all the first aid. Or if it is referred from secondary to tertiary care hospital, the patient should be admitted in ICU or toxicology or high dependence unit, depending upon the patient's condition. And the PLEX will be given depending upon the INR and the conscious level. So, INR, the LFT, and the conscious level of the patient is very, very important. So, the PLEX will be determined depend upon the INR, the LFT, and consciousness, but it should be determined only by the physician, treating physician. It should not be decided by the transfusion medicine person. So, the role of the transfusion medicine person is to give PLEX when and where demand arises. So, the INR, the consciousness are very important. Next. So, the treatment protocol, actually, initially, we started following the Tamil Nadu gastroenterologist treatment and the CMC Vellore model. As Sa has said, when it evolved, we started taking up the cases little bit earlier. First, as the guidelines, when we were going for training, the indication was INR should be more than 4, this and that. But when we were evolving with the cases, with the process, so we found out if we take the case very early, when the INR has started increasing and LFT has started increasing, we take the patient little bit earlier, the recovery is excellent. Then we are following the centrifugal method. That's okay. So how we were able to do this? We were given training in CMC Vellore, and Department of Gastroenterology and Transfusion Medicine of CMC Vellore. They gave the training for our medicine department, emergency department and transfusion medicine department. We were given hands-on experience in the plasma exchange, and they have trained 6 sub-centers in 3 batches, and CMC Vellore has trained 25 doctors, government doctors, 13 nurses and 11 lab technicians. Next slide. And in the journey, we were selected as Apex Training Center for giving training, PLEX training to our government hospitals. So, our Coimbatore Medical College Blood Center and General Medicine Department, along with multiple departments, anesthesia, nephrology, all the departments and gastroenterology put together, we gave training during the period of May 2023 to Jan 2024. We trained 169 doctors, 169 nurses, 76 technicians, and totally PSC and Dolly Hospital is 131. So now we have trained the people, and few centers have started doing PLEX in the medical college. Next. So what's how we have delivered the hub and spoke model across our Tamil Nadu state. So what's our success story? We have done across Tamil Nadu, PLEX was done for 1,400 patients, and death averted was 64.2%, and only 3 patients access to liver transplant. In Coimbatore Medical College alone, we have done plasma exchange for 344 patients, and we have discharged 256 patients. Next. So here I want to say it's a teamwork. Transfusion medicine department, medicine department, or toxicology unit, gastroenterology department, nephrology department, anesthesia, all the department, we have to work together along with our Tamil Nadu government and NHM Tamil Nadu and experts of hub and spoke. We together worked and brought up this success in Tamil Nadu. Next. And actually the future plan to expand to actually 6 more districts. Actually it is now, by the time I have come here, they have given the Air Force mission to 3 more districts, and the training is over in Coimbatore Medical College now for another second set of people. The PLEX training and the hub and spoke training, it is finished by the time I am here. So these 3 has been finished already. It is not future plan, the plan is over. Next. Next. So the conclusion is the plasma exchange is cost effective. Next, it is easily accessible. It is easily accessible for the poor patients. And the time delay is avoided, mortality is reduced, and it is an effective treatment. This is PLEX. Next. Hub and spoke. Hub and spoke model is a very effective plan for plasma to deliver plasma exchange in the treatment of referral poisoning and involving the primary and secondary care center. That is, primary and secondary care center should do the basic stabilization and referral work, and tertiary care center should do hub and spoke model. So plasma exchange is a easily accessible, cost-effective treatment, and that should be delivered through hub and spoke model involving primary and secondary care center, and the specialized procedure like plasma exchange should be done in the medical college. So we have done it effectively, successfully, and we have saved many lives in Coimbatore Medical College, and we are also giving training to all the people. So I wish all of the person who have come here to carry this message along with you. Initiate plasma exchange in your medical college hospital and spread the message. Thank you.
Thank you, ma'am, for that elaborate presentation on hub and spoke model.